everyone, I'm Athena here from Language Disorder Australia. In today's video, I'm going to be talking about language disorder and some of the early warning signs or red flags for children aged 1 to 4 years. Important to remember that all children are different and all children grow, develop and learn at different rates and at their own pace. So when thinking about typical language development, the spectrum is fairly wide. This is because of the unique nature of our children and the considerable variations and differences in the language of one child compared to the next, even when they are the same age. This is completely normal. So how do you know if your child may be experiencing a language disorder? Well, fortunately, there are a number of warning signs or red flags that can signal that your child may be experiencing some difficulties with language, and it might be time to seek some professional advice. Let's talk about the red flags by starting with our little ones. For children 6 months to 2 years, parents are looking for signs that their little one is starting to respond to communication and language, and is also making some attempts to communicate with them by using language with others. This can look like a child turning their head when their name is called, babbling, pointing, using gestures, and following a simple instruction such as stop or no. If your child isn't demonstrating these skills, this can be a red flag that they may be experiencing some language challenges. As a child reaches 2 years of age, the typically developing child will start to say more words and will begin to combine these words into 2 or 3 word phrases. This can sound like more please or doggy sleeping. At this age, play extends to pretend play, and use of action words can be heard during simple play scenes. This can look like feeding a doll or putting a doll to sleep, and your child saying sleep or eat. If a child is not demonstrating these skills or is saying less than 100 words, not imitating action words, continuing to have difficulty following simple instructions, and family are understanding less than 50% of that child's speech, this can be a sign of language disorder. At 3 to 4 years of age is when children begin engaging in pretend and imaginary play with other children. They become more inquisitive by asking questions and using more complete sentences to express themselves. And this can sound something like, my train is broken, or I want this one. If a child is having difficulty in these areas, it's time to speak to a speech language pathologist and discuss language disorder. Remember, early identification and intervention is key to ensuring the best outcomes for our children with language disorder. If these red flags are apparent in your child, or you're simply concerned about how their language and communication skills are developing, the best thing you can do is seek professional advice from a speech language pathologist.